Alright, week 3 is nearly done, so I'll tell you about week 2 and week 3. Week 2 I was in obstetrics again. The start of the week was pretty slow, not too many babies being delivered, but I delivered 2 primips and that was pretty fun. Later on in the week, on the Friday, we had an emergency cesarean that needed to be done, and what happened was this lady had already delivered the first twin the night before, and he was quite a small baby, like 1.4 kilograms or something like that. But the other baby was still stuck in there and it was in transverse lie, so it wasn't going anywhere, so we had to take the woman in for surgery. She didn't go in for surgery until about maybe 11:30 the next day. Anyway, when we opened her up, all that came out when we opened up the uterus was a little hand. So the doctor and I had to fish around in the uterus to try and find the head, but it was pretty well and truly stuck. So the cesarean turned from a lower uterine segment cesarean to a classic cesarean. So the cut went straight up the middle of the uterus, and it just looked so messy. There was blood going everywhere, but we managed to get the baby out. Needed a little bit of resuscitation, which Tim and the rest of the nurses and community health workers helped out with, and the baby came back, and managed to stitch the woman up, and she's all good. She's going home on the weekend and she's looking pretty okay, which is great. This week, well, I've been in outpatients yesterday and today. On Monday I was feeling a bit sick, so I didn't go in. And on Tuesday we went to Rumganay, to the community health worker college up there, and we taught history taking and examination of the nervous system, as well as meningitis, brain tumours, and a bit of, mental health. Yeah, quick rundown of mental health, which was thrown on us last minute, so it was a bit underprepared, but it went pretty well, I think. It was kind of fun getting out of Kyoga for a day, just to go and see another hospital and see another little village, I guess, see how things are done differently in other places. So Wednesday and today I've been in the outpatients department, and I sort of feel a little bit lost, I guess, because their resources are pretty low, and the diagnoses for all the patients is very different to what I'm used to. So you see a patient coming in with fever, and back in Australia, your differentials were things like pneumonia and urinary tract infection and just even the common cold. But here, pretty much everyone who has who has fevers has malaria, so you've got to rule that out first, no matter anything else. So, yeah. And it's really funny here when they're prescribing medications for anything. Anyone who comes in with viral symptoms gets put on Panadol and amoxicillin and sent away. Anybody who comes in with a fracture gets put on Panadol and amoxicillin and sent away. Anyone who has anything wrong with them gets Panadol, amoxicillin and sent away. So it's pretty different, and I'm a little bit concerned about resistance of the amoxicillin. I think it's more placebo than anything else at the moment, the way they're using it. We had a lady who came in yesterday, an old lady who had a fractured neck of femur, and obviously they don't have orthopedic surgery here, so the treatment of choice is traction, good old-fashioned traction. So we gave her a bit of pain relief, gave her a femoral block, put her leg back into alignment and tied a massive weight around the end, which was 10% of her body weight. I think it was about 8 or 9 kilos that we ended up putting on there. And that's all they do. She has to stay in bed now for 12 weeks and wait. And they didn't give any DVT prophylaxis, which I thought was interesting, but we did bring it up, and they sort of just like wave their hands and be like, oh, it's alright. I haven't seen any DVT prophylaxis being used here, so a little bit concerned about that, but that's okay. And really that's about it. Today I admitted a girl to the ward who looks like she probably has HIV. We have to wait until tomorrow because they don't like the doctors or the HEOs or the community health workers or anybody else doing HIV counselling. They've got a special HIV clinic, and people who are specially trained come out and talk to the patients before they do any testing. So we have to wait till tomorrow to be able to do that with her. It might be a bit difficult because she's handicapped, so we'll see how it goes. Anyway, that's it for today. Bye!